Okay, we're talking about retrocalcaneal heel spur and how to do this minimally invasive. This is usually reserved for mild to moderate spurring in the back of the heel. For larger deformities, you're still going to have to do your detachment and reattachment of the Achilles tendon for the majority of the patients. So basically, you can get a pretty big spur out, but the ones that are in the tendon and you have large, intertendinous type of calcifications, the only way to get that out is to actually open that up. So you have to be able to do both of these types of surgeries. So you see this patient here, this is kind of the patient you can do minimally invasive. They got a pretty big Haglund's deformity. By the way, whenever you have a posterior heel spur, you always have a Haglund's deformity as well. They go together. And in this patient, you can see there's a spur here and the back here. So this is the Haglund's portion. So what we want to do is make an incision on both the medial and lateral portion of the heel, and that's going to be done about right here. And we're going to take a burr, usually a 3-1, and take that Haglund's off. So step one is to remove your Haglund's. And in an older patient, it comes off pretty quick. Younger patient, it does take some time. The surgery is actually no faster than open surgery. So if you do really well with open surgeries, it'll be the same. But here is what we are finding. The minimally invasive surgery has lower VAS scores afterwards, and also can get back to activity quicker, which we'll show you on video. So basically what we're going to do, we're going to go underneath the tendon and make our incision and begin to remove the basically what is amounts to the not the retrocalcaneal spur, but the Haglund's deformity first. You can see the retrocalcaneal spurring is right here. You don't want to go too far down, you'll disrupt your insertion. So you're going to go across here and about like that. And then once you have your retrocalcaneal spurring your Haglund's off, you'll go and do a superficial incision and keeping the tendon intact here, begin to remove and stepwise, slowly, a little bit at a time, the actual spurring. So this is where the shoe is going to hit, and you won't have any pain after that. So we're going to show you a couple videos here of a patient post-op 1 week and also a month later, and how that works. We got 2 videos to show you. This is a patient I want to show you. We did a minimally invasive heel spur resection of the posterior heel, and it can be done minimally invasive. What we do, we take the Haglund's deformity off first, and then we go to the superior portion of the tendon and remove the actual spurring. And we do both of these through a percutaneous incision. You can see, here's this medial aspect of the approach. So the medial aspect, we make an incision here, and that allows us to get the Haglund's deformity smoothed down. Then we make an incision on the distal portion here and go on top of the tendon and get the remaining spur out from this portion. So it keeps the tendon intact. If you look at the lateral portion of this foot here, you can see we did the same thing there. He's got an incision up here, which is on the superior aspect of the area, allowing us to get the Haglund's deformity off, and then we go superior to the tendon and get the rest of the spur out. What's really neat about this is that this is only 1 week after his surgery, and he's ambulating in this cam walker, and we're going to talk to him about his pain levels. This is what I find really remarkable about the posterior heel spur approach, minimally invasive. Now with your foot, on a scale from 1 to 10, 10 being really bad pain, before you had this surgery, what would you say it was?
9.
So it was a 9 a lot of times. Now you've had this surgery only 1 week ago. Of course, we got to see how it does as time goes. But you've had it only 1 week ago. What is your pain level now?
I don't have no pain.
So there's no pain.
No pain.
So it's pretty remarkable. He's had a surgical intervention, yet has no pain with this, even at just 1 week, and we've been able to take his spur out. So it's a sort of a new approach. I've never really read it in the literature, so I don't think it's been out long. There's a couple of guys who talked to me about it at some of our meetings. So it needs to be kind of followed up. It's being done now in some of the other countries, and so they're going real full force with this. This type of surgery, when it's done traditional, can really lay you up for a while. And I'll do that surgery as well. I'll do the open surgery, and that's a 6-month recovery. It's a long recovery. So now you're talking about a guy you went back to work already, hadn't you?
Yeah.
He's already back to work, and it's only been a week. So we're going to let the suture stand there another week. We'll just put Band-Aids over that. He's going to keep wearing the cam walk until I tell him we can kind of go kind of full force on it. But pretty much no pain already after just a week. Okay. Today we're going to show you a patient with a post-op minimally invasive retrocalcaneal spur removal. This works real good in most patients, and the recoveries are much quicker than our traditional way of detaching the tendon and reattaching the tendon. This is an example of this patient, and we'll show you his x-rays because it looks different than traditional procedures. So basically a patient with a heel spur in the back of the heel, what they're going to have an underlying Haglund's deformity, which we address by making an incision here, and on the outside these are percutaneous incisions, and we reduce the basic Haglund's portion. So if you were to look at the back of someone's heel that had a Haglund's deformity, basically it's a little lump up here that interferes with the tendon moving properly. He also has a spur on the outside portion. So the way this works is the tendon is being pinched by this little bump here, which we call the Haglund's deformity, and then shoe pressure hurts the heel back here because there's a little spur here. So what we do, we first take off this area here, which we do through here, and then we make another small incision, which you really can't see on his foot now, and we go on the outside of the tendon. We don't detach the tendon, and the spur that's on the outside, we reduce that, or we detach the spur from the plantar aspect of the Achilles. And then what that will do, the spur will still be intertendinous, but it won't be attached to the bone, so basically it doesn't hurt. So we're removing the Haglund's deformity and freeing the spur from its attachments, and trying to get most of that out, to get as much of that out as we can. But basically most patients are pain free with the procedure. So it allows us to do this without detaching the tendon, without excessive post-op recovery, which the traditional surgery does have. Now, how long are we out now with our surgery?
This is my 5th week.
So this is week 5, and he's already been able to walk without a shoe. When did you quit wearing a boot?
First of last week.
First of last week. So you wore a boot about 4.5 weeks, and not having that huge recovery you have with open heel spur, or retrocalcaneal heel spur. With very similar results. As a matter of fact, the VAS scores in the earlier aspect of this surgery are vastly better so far. So basically, now with your foot, before the surgery, what, six weeks ago? Was it six weeks? Roughly 6 weeks ago. Your foot 6 weeks ago. What was your pain scale from 0 to 10 on a daily basis?
8 to 10.
8 to 10. So now that you've had this done, you've been walking with your regular shoe, or at least a surgical shoe. What is your pain in your foot now?
I had no pain.
Zero pain. So we've got zero pain in this surgery without him being on an extensive post-op journey, trying to get his foot better. Now, that doesn't mean that the open surgery doesn't work. It does work. The open surgery works. It's one of the best working procedures that we have. It's just that the recovery is so long. Some people, when we do open surgery, it takes them 6 months to get over. With this particular surgery, they're good to go in about 8 weeks or so, back to even work. Are you back at work now?
I'm back at work.
So he's already back at work. So obviously, if we'd have done this open, he wouldn't be back at work. Matter of fact, he told me today, so when we're going to do my right foot, and we'll get that done as soon as we can too. So basically, this is a great procedure. You don't burn any bridges. If you have to go back in open, you could still do that. So worth a try in some of the patients. Obviously, a really, really big posterior heel spur, you would still have to open. So these are going to be your calcifications that are thinner in the posterior area, or milder. So there's no real way to say when it works and when it doesn't. But so far I've been doing this on kind of people that have the Hadlins, which are always present in a posterior spur, and who have a retrocalcaneal spur that is thinner, or we were able to detach it from its insertional area. So I need to make sure we kind of are clear here and give you a little bit of a warning. The possibility of attaching the Achilles insertion is considered when doing these surgeries. So the surgeon must be ready to reattach the tendon if needed. This can be done actually with bone anchors that people like Stryker and different companies make. All kinds of companies make these things. Or you can do a bone pass, which I'll be glad whenever I get back into the lab, I'll show you how you can do a bone pass without needing an anchor. So if you're doing this in the office and you decide to do posterior spur and you accidentally detach your tendon, you can still reattach it by using a bone pass in the heel. So the procedure should only be attempted by surgeons very skilled at both open and minimally invasive surgical techniques. To deal with the complications during the surgery, you'll need to be able to have the ability to tag these tendons back down if needed. So this is best for people who are trained really well both minimally invasive as well as open surgery. This is not a beginning level surgery. I would not even consider doing this until I was doing minimally invasive surgery for 4 or 5 years. So you can get your feel down for this. You got to make sure you're staying on the bone, not hitting any soft tissue. So this was a more advanced procedure, and it should be done only by people very skilled at MIS surgery and very skilled at open surgery as well.